Hello, everybody. Good morning, good afternoon, good evening. We will discuss today the role of e-health in the future of healthcare. And there are many things to say about that. But in the 50 minutes I have, I will explain you the basics of that. So this is my disclosure. And let me first dwell a little bit on the four waves of industrial revolution we have seen in the past. And there were a couple of technologies that disrupted our society, like steam and electricity. But from the 50s till the year 2000, maybe 2005, we saw the advent of large computers, smaller computers, handheld systems, robotics, but also of the internet and ICT technology taking off in an exponential way. And that's where e-health arises. And e-health is born in this age. I think maybe the term first appeared in 1999. And today we see really a revolution in data, and we need intelligence for that. So there are many technologies also used for medical purposes that make use of data, and I'll come back to that a little bit later. So what exactly is e-health? Well, it's a catch-all term which comprises many technologies which are making use of the internet, for instance. So it could be telemedicine or video consulting, could also be mobile phones coaching a patient. But it has also deep ramifications in other things like integration, interoperability, and maybe legal aspects. So there are many definitions. Some people talk about health 2.0 or digital health, and that's all the same. So there's no one single definition, but all these technologies that you see here are included. And let me give you some examples. So here are some examples. I show you some technologies. I won't discuss them all, but for instance, in the middle, you see virtual and augmented reality of surgeons that are starting an operation just before they are looking at the heart. You can print even the heart for maybe educational purposes and color it. And you see this man lying with his back towards us, and that's the HoloLens who's working there. So there are many of these things that we have today, thanks to the rise in technology and the new things we have around us, and are more or less being part of our society, or becoming a part of our society. So also in healthcare and life sciences. So one of the things which are researched, and there's a great interest, is lab on a chip. So what you see here is a chip where you drop some blood, and because of the capillary function and capabilities, it's sucked into this system, which is a very small, like a chip, and it analyzes the blood. And this is used, for instance, in HIV infections for counting the number of CD4 plus T lymphocytes, but there's still a lot of research in this biosensor and bioelectronics. So for instance, this one, lab on a chip, also for HIV, and here's another one that can detect different viruses, amongst them HIV, and I've put the references, so if you are interested, you can take a further look there. But this is a very active field. Here's another one, even a wearable. I had it on my screen, wearables and swallables, but wearables are very common in healthcare and life sciences. This is a wearable for rapid detection of the HIV-1 DNA. And so you see it's like a wristwatch, and that it works together with an app that determines whether or not something is present. So in short, there's a lot of potential for e-health tools. So you see the Vitruvian man here at the right-hand side with his smartphone, fitness trackers, smartwatches. But at the same time, this imposes a bit of a problem, because there are a lot of different tools out there that are maybe aiming at the same goal, but they might not be gauged in the same way. They might not be using the same standards, and that's one of the problems. Are all these tools clinically relevant? But the big challenge is the holy grail, I would say, how to distill insight and more knowledge about the patient from the data that we can gather from these tools. And I'll come back to that a little bit later. But there's an abundance of tooling here, and I think that in the future we will see more of them and clinically relevant tools anyway. So this is an example I took from Diabetes Care. This is an app that is really a personal coach for the patient in question. It's not a diabetes app that takes your blood values or your sugar values and puts it in a nice graphic. No, this is more. It takes into account the whole context of the patient in question, like exercise, food. He can even take a picture of the food, and the system would calculate the calories involved, you know, and it takes into account the data from all the patients that are using this, and there are thousands of them. And because of that, the app can project a low blood sugar event just up to 4 hours in advance, where the state of the art was a half an hour. So this is an extremely good example of how data can be used to improve the life of the diabetes patient. And it achieves also extra time, even in hyperglycemia events and also hypo events. So this is how this could work. And there are apps for HIV and AIDS. Most of them are just information gathering, both for the patient and for the professional. But you see this Happy app, which is a Dutch app that's more involved. That's really a coach. So it looks a little bit like the app I showed you before. But we will see more of these apps, and of course they need to be certified, but put together not only by ICT people but also doctors. And that's exactly what happened to the Happy app, but it's more and more. And also chatbots are something that is very common now in healthcare and life sciences, thanks to the ICT technology, thanks to artificial intelligence and natural language processing. And you see here the health app of Dr. AI from the US, Babylon Health from the UK, and Baidu from China. So from different parts of the world, this is used, and there are many of them. And one of them is Marvin, which engages HIV patients in their antiretroviral therapy, and it will be discussed, I think, during this conference. So we will see more of that in the future. So it's really a combination of natural language processing and ICT technology that's here. Now, let me dwell a little bit on artificial intelligence, which is one of the fields that is upcoming, and there are a lot of applications. I will show you in a minute a couple of those that are even FDA compliant, but it's a combination of computer science and many more fields, as you can see, ethics, law, and philosophy. But the aim is to create intelligent machines that work and respond like us humans. And there are many, many technologies and specialities in AI, so don't think that AI is machine learning, and maybe you've heard of that, or is natural language processing. There are many, many technologies under the roof of artificial intelligence. And here is a list of well, this is not the total list, but it's a nice list of applications in healthcare and life sciences that have been approved by the FDA. You know, and so this is great, and I'm sure that in the future applications for HIV, AIDS will arise in this list. So how would you apply artificial intelligence to HIV? It could be diagnosis, could be therapy, it could be population health, prevention. All the angles can be well, they carry data, so you can do something with artificial intelligence. And if you go to the literature, then you see this is maybe an older paper, 3 years old, but it also projects how you could use the data and these deep business analytics technologies to the HIV/AIDS pandemic. Here's another one. machine learning and HIV to end it. And I checked with PubMed line, and you see an uptake of papers that are writing about HIV and artificial intelligence. So I think this is a field from which we will see more in the future. And just to give you one example, there's an abundance of literature, around HIV and viruses in general. On PubMed line, every 30 seconds a new summary is being published. Every 30 seconds. Not everything has to do with HIV, of course, but maybe a couple of papers per day. By the end of the month, you have a pile of papers that you need to read. But you can use technology here. There's something called medical literature search, which enables you within seconds to go through this mountain of literature on the basis of syntactic and semantic search. Because it's really impossible for the doctors and the researchers to keep abreast with this field, because the volume and the rate of change, sorting it out, combining or connecting the dots in literature. So there are many technologies now available to help you to find new drugs more quickly, to find new treatments more quickly, because you can lay your hands on the vast amount of papers that is available. So this is just one of the applications of natural language processing and machine learning in this field. Finally, there are of course challenges, because not everything can go into healthcare and life sciences processes. You need some certification. For instance, there is regulatory aspect. What are the legal implications? What's the liability with these systems? It's like software as a medical device, for instance, or just a plain medical device that needs quality label, CE marking. Is it GDPR compliant? All that kinds of things needs to be tested. There's also an economic aspect. Who is going to reimburse it? This is something new most of the time. Who's going to purchase it? Can we get that from the hospital? Who is going to do that? Structural, doctors, students, researchers need to adopt. They need to learn about this. But also you need to test in a scientific method the sensitivity and the specificity of these new e-health applications. And you need to have maybe new curricula at the universities where you insert e-health and maybe analytical methods. And last but not least, there's a technological factor, because you need a good platform maybe, or an infrastructure that's able to capture data, but also to exchange data, and that needs standards, interoperability standards, and integration standards. So these are a couple of challenges, but people are actively working on all these aspects, and there are more. This is not an exhaustive list. Anyway, I see a bright future for the application of e-health, and especially artificial intelligence and natural language processing, machine learning in the field of viruses, HIV and AIDS. And with that, I hope to have given you a brief introduction into this field. Thank you very much.